Hello students, very great day. So today what we are going to see is TN MRB Dental 2010 paper. So just before exam, go through the question and answers alone. Okay, I'm not going to take in detail about all the questions. I'm just going to say what is the answer for each question and very important points related to the some questions. Let's start with this. Okay, TN MRB Dental, right? What is the first question? The first question is they're asking about what is the drug used for the ventricular arrhythmia. So the drug of choice for ventricular arrhythmia is obviously lignocaine, because lignocaine is an antiarrhythmic drug. Right. Let's see about other option. Digoxin. Digoxin is the drug of choice for congestive heart failure. Diltiazem is a calcium channel blocker. Phenytoin is the anti-epileptic drug. Right. So let's go for the second option, students. So the second question. So answer is lignocaine. What is the ketoconazole? Ketoconazole is obviously what? Antifungal drug. Easy question. Very easy question, right? Yes. Come to the question. Acts through dopaminergic acts and go for the third option. And what is the meaning of muscarinic? Muscarinic is actually something called cholinergic. Cholinergic is what? Sympathetic. Right. So chlorpromazine, which also act on muscarinic receptor, but which is predominant means dopaminergic is predominant than your muscarinic. So we go for option C. Right. This is a question from your first chapter in Pulse Anatomy Osteology. Direct straight to question from the Pulse. So what is the question is about suprameatal triangle externally represent. What is called as suprameatal triangle? Suprameatal triangle is the fourth option students. What is the shortest? So usually confused with the shortest and the smallest cranial nerve. The shortest cranial nerve is first cranial nerve, that is olfactory cranial nerve. What is about smallest? Okay, smallest means they're talking about thickness. So which is the very thin cranial nerve? Thin cranial nerve is fourth cranial nerve. Otherwise, you may get a question like which is having slender, which is the slender nerve, trochlear nerve is the slender. Similarly, for your exam, you may get a largest and longest. What is the meaning of longest? Length. So longest is vagus. Longest is vagus and largest is what? I'm talking about largest means thickness. Thickness is what? Trigeminal nerve, right? Fifth cranial nerve. Right. Students, will go over to the next question. The next question is about the greatest thickness of the cementum is founded. The greatest thickness of the cementum is founded obviously apical third of the root. And here, some more point extra. What is the type of cementum which is present in the apical third of the root? In apical third of the root, you will be having something called as cellular cementum. Cellular cementum, right? And students, what about coronal? Coronal, you have something called as acellular cementum. And student, there is one more very, very important point from the oral pathology. They may ask you this question. In which condition you will be having absence of cellular cementum? So you can see multiple unerupted teeth. What is the answer? Yes, that is cleidocranial dysplasia. So very important question, students. Right. So next question is about what is the muscle which forms the bulk of the tongue? The answer is about genioclasses, right? So genioclasses is the bulk of the tongue. And what is one more special about genioclasses? Genioclasses right? The genioclasses is not able to. So that's why it is called safety muscle of tongue. And students, remember, there is one more extra point here. So you may get a question like, which muscle is called a safety muscle of larynx? The safety muscle of larynx is posterior cricoarytenoid. Students, so the session will be little fast only. So என்னென்ன கோர் பாயிண்ட்ஸ் வேணுமோ டக்குன்னு அதை மட்டும் எடுத்துக்கோங்க. இல்லைன்னா அந்த இடத்துல ஏதாவது உங்களுக்கு புரியலன்னா பாஸ் பண்ணி இன்னொரு டைம் செக் பண்ணிக்கோங்க. பிகாஸ் I don't want you waste much of your time at the end of the just before exam, right? Okay, so students, we go for this question. What are the obviously palatine and macula So this is the next part by so what is so students remember, in face we have two different type of nerve supply, one which is called sensory and motor. What about the motor nerve supply? The motor nerve supply is by facial nerve and the sensory supply is by the trigeminal nerve. Right. இப்போ இங்க என்ன கேட்டிருக்காங்க, மசில்ஸ் பத்தி கேட்டிருக்காங்க. So it is a facial nerve, but exception. Okay, எல்லா நர்வுக்குமே ஒரு எக்ஸெப்ஷன் இருக்கும். இந்த இதுக்கும் அதுக்கு மாதிரி ஒரு எக்ஸெப்ஷன். All the muscles of face supplied by the facial nerve except one muscle that is called levator palpebrae superioris, LPS. LPS is supplied by third cranial nerve. What is third cranial nerve? Oculomotor nerve. Right, students. So coming to the next part, which following muscle causes retraction of mandible? Students, it is so important that muscle of tongue is very important chapter in your exam. Which muscle causes retraction? Obviously, what is a muscle? The muscle is called temporalis. And the same question which may modified and asked in oral surgery also, like which muscle is involved in the coronoid fracture? Yes, that is also temporalis because the so investigation. All causes protrude except that is temporalis. And இதை வச்சு இன்னொரு கொஸ்டின் கூட கேட்கலாம். உங்களோட 2025 MRB Dentalல இன்னொரு கொஸ்டின் கேட்கலாம் அப்படின்னா, elevation of mandible, depression of mandible வச்சு ஒரு கொஸ்டின் கேட்கலாம். For example, elevation of mandible. What is the meaning of elevation of mandible? Elevation அப்படின்னா close the mouth அர்த்தம். Okay. So இப்போ for example, ஒரு மசில் பேர் சொல்றீங்க, மசில்ஸ் ஆஃப் மாஸ்டிகேஷன்ல மசில் பேர் சொல்றப்போ உங்க லிப்ஸ் டச் ஆகுது அப்படின்னா அந்த மசில்ஸ் எல்லாமே which helps for elevation of the mandible. Okay, for example, say masseter lips touch ஆகுதா? So masseter which helps for the elevation. And say medial pterygoid, so lips touch ஆகுது, so that is also for elevation, mean close the mouth. So say about temporalis, lips touch ஆகுதா? So that is also for closing the mouth, so for elevation of the mandible. But when you say lateral pterygoid, your lips are not touching, so this lateral pterygoid which helps for what? Depression of the mandible. What is the meaning of depression of the mandible, students? Depression of the mandible அப்படின்னா opening the mouth அர்த்தம். So இது ஒரு கொஸ்டின் கேட்கலாம், which is the only muscles of mastication which helps for the depression of mandible கேட்டா, then we can go for what? Lateral pterygoid. Yes, so this question retraction கேட்டிருக்கிறதுனால we go for temporalis. Students, 11th question, trigeminal neuralgia most commonly affect which side? Left side or right side? Very easy question, students. Okay, so trigeminal neuralgia second letter enna R, so you can remember right side. 2024 NEET exam la ஒரு question இதே மாதிரி கேட்டிருந்தாங்க, cleft lip is more common on left side or right side னு கேட்டிருந்தாங்க. So students, உங்களுக்கு கூட இந்த question கேட்கலாம். Cleft lip plus second letter என்ன? L. So cleft lip is more common on left side. நான் வச்சுக்கலாமா? Right. So வேற என்ன question கேட்கலாம்? Trigeminal neuralgia ஓட other names கேட்கலாமா? Fothergill's disease, tic doulorex, and what is the drug of choice for trigeminal neuralgia? So பழைய question, but இருந்தாலும் ரொம்ப important question, carbamazepine. Okay, so இப்போ உங்களோட ரீசெண்டா உங்களுக்கு கேட்கணும் அப்படின்னா வேற என்ன கேட்கலாம்? What is the recent treatment for recent therapy for trigeminal neuralgia ன்னு கேட்டாங்கன்னா what should be your answer? So answer is gamma knife radiosurgery. Students, gamma knife radiosurgery, right? Students, the next one, cotton wool appearance seen in some easy question illa. Cotton wool appearance seen in what? Page's disease. What is called achondroplasia? Achondroplasia is the most common cause for short stature. Fibrous dysplasia, bone is replaced by the fibrous tissue, which is called a fibrous dysplasia. Cooley's anemia. This is the 2023 oda NEET exam question. What is called Cooley's anemia? Cooley's anemia is beta thalassemia major, otherwise called as Cooley's anemia. Maybe MRB la kekkalam. Just a fact-based questions. So in that, the answer is what? Page X. Right. Students, coming to this point, what is the malignant tumor of the striated muscle? Okay. Striated muscles, students. Striated muscles are skeletal muscle. Okay. So malignant tumor of the skeletal muscle or striated muscle, anything if they ask you, you can go for what means rhabdomyosarcoma. Suppose it is smooth muscle, you can go for leiomyosarcoma. So here the striated muscle கேட்டதுனால rhabdomyosarcoma. Students remember what is called a sarcoma, what is called a carcinoma. Carcinoma is malignancy of the epithelium is called as carcinoma. Malignancy of the connective tissue is called sarcoma. The second difference, main difference is carcinoma usually spread through lymphatics. Sarcoma usually spread through the hematogenous, that is blood route. Right, students, so answer is rhabdomyosarcoma. So recurrent aphthous ulcer, otherwise called as what? Is answer is what? Yes, canker sore. Canker sore. Right. So next question. This is a tricky question, very tricky question. They're asking about oral cytology is used in for which of the following thing. Okay. So oral cytology எங்க யூஸ் பண்ணலாம் அப்படின்னா யூஸ்வலா என்ன பண்ணுவாங்கன்னா கேண்டல் இன்ஃபெக்ஷன் யூஸ் பண்ணுவாங்க. There is something called PAS, periodic acid skip stain, that is used for the cytology of the candle infections. Squamous cell carcinoma யூஸ் பண்ணலாமான்னு கேட்டா யூஸ்வலி கார்சினோமாக்கு will go for biopsy. Okay, cytology பெருசா யூஸ் ஆகாது. அதனால so we not go for squamous cell carcinoma. Lichen planus திருப்பி உங்களுக்கு கேட்டுட்டு இருக்க கொஸ்டின், some important topic. லைக்கன் பிளானஸ்ல எங்க கேட்கலாம் அப்படின்னா ஹிஸ்டாலஜிக்கல் ஃபீச்சர் கேட்கலாம், ஷார்ட் டூத் ரெட்டிபெக்ஸ் கேட்கலாம், அண்ட் எபிதீலியம் கனெக்டிவ் டிஷ்யூ செப்பரேட் ஆகும். செப்பரேட்ல ஒரு சின்ன ஸ்பேஸ் கிரியேட் ஆகும். அந்த ஸ்பேஸ் பேர் என்னன்னு கேட்கலாம். இந்த ஸ்பேஸுக்கு பேரு மேக்ஸ் ஜோசப் ஸ்பேஸ். Student, I just repeat one more time. What is the space between the epithelium and connective tissue in the lichen planus? It is called Max Joseph space. And அதுல lichen planusல ஒரு பாடிஸ் இருக்கும், இன்க்ளூஷன் பாடிஸ் இருக்கும். அந்த இன்க்ளூஷன் பாடிஸ்க்கு பேரு கொலாய்ட் பாடிஸ் or ciliate bodies. Right. So students, next question. Oral submucous fibrosis, it shows fibrous band இருக்குமா? Yes. So நம்ம palpate பண்ணி பார்த்திருப்பீங்க, SMF casesல band இருக்கும், நல்லாவே palpatory epithelium atrophic ஆயிருக்கும். So obviously patient will have trismus. So the answer for this question is all of this. Okay. So and what is one more feature of submucous fibrosis? Oda histological picture ni keta retipex is absent. Okay, sawtooth retipex எங்க நம்ம படிச்சோம்? Okay, lichen planus. Okay, அதே மாதிரி test tube retipex னு இருக்கும் students. Test tube retipex. Okay, test tube retipex எங்க இருக்கும்னு கேட்டா which is seen in dilantin hyperplasia. அது என்னது dilantin hyperplasia? Dilantin hyperplasia அப்படின்னா the hyperplasia, gingival hypertrophy which is caused by the phenatine is called dilantin hyperplasia. Okay, அந்த இடத்துல test tube retipex இருக்கும். எந்த இடத்துல retipex இருக்காதுன்னு கேட்டா SMF. Okay, OSMF, right. Students, next question. Dense dentae is called as some easy question. Dense invaginatus. Where na question கேட்கலாம்? Dense invaginatus most commonly affect which teeth ன்னு கேட்கலாமா? Maxillary lateral incisor. வேற என்ன question கேட்கலாம்? Dense evaginatus இன்னொரு பேர் கேட்கலாமா? நம்மளுக்கு 2025ல dense evaginatus is called as occlusal enamel whorl. And dense evaginatus most commonly seen in mandibular premolar. Right. Students, next question. Increased caries occurs when patient is having some easy question, right? Sjogren syndrome, patient is having xerostomia. Yes. So we can go for option C. What is called silodinitis? Silodinitis is, yes, adenitis, inflammation of the salivary gland. Okay. Silolith. What is called lith? Lith means stone. Okay. And pleomorphic adenoma, you know, most common salivary gland, benign salivary gland tumor is pleomorphic adenoma. Most common gland in keta parotid. Parotid la endha part in keta tail of the parotid gland. Right. Students will go for the next part. Okay. Which one of the following is the fissural cyst? What is called as fissural cyst? Fissural cyst அப்படின்னா ஒரு ரெண்டு ப்ராசஸ்க்கு நடுவுல எபிதீலியம் entrapment ஆச்சுன்னா அந்த இடத்துல ஒரு சிஸ்டம் மாதிரி கிரியேட் ஆச்சுன்னா அதுக்கு பேர் தான் fissural cyst. இந்த இடத்துல ஒரு medial nasal ப்ராசஸ்க்கும் maxillary ப்ராசஸ்க்கும் எபிதீலியம் entrap ஆச்சுன்னா what is the cyst will get? This is called as globulomaxillary cyst. Right. Students, next question. Which is the narrowest constriction of the normal root canal? Okay, root canal இருக்கு. Root canal இருக்கு. இந்த narrowest பார்ட்டுக்கு பேர் என்ன? Okay, இந்த இடத்துல root canal narrow ஆகும், திருப்பி கொஞ்சம் பெருசாகும். இல்லையா? So what is this narrowest root canal is called as? The narrowest root canal is called as minor diameter, students. Minor diameter, otherwise called as what? Apical constriction. Okay, so சின்ன constriction வந்ததுக்கு அப்புறமா இந்த இடத்துல கொஞ்சம் dilate ஆகுதா? The end part is called apical foramen. Apical foramen is called as major diameter. Minor diameter க்கும் major diameter க்கும் நடுவுல ஒரு triangle shapeல ஒரு space இருக்கா? இந்த இடத்துக்கு பேர் invert funnel shapeல ஒரு shape இருக்கா? இந்த இடத்துக்கு பேர் apical delta. Right. இந்த minor diameter என்னது அப்படின்னா CDJ, that is cemento-dentinal junction. Students புரியுதா? Okay, கொஞ்சம் ஃபாஸ்டா தான் போறேன், பட் நம்மளுக்கு டைம் இல்லை அதனால. Okay, right. Students, next question. If the leukocytes are along the walls of the blood vessel, what is this? This is called margination and fragmenting. When it is coming out, it is called emigration. Okay, and movement of the towards the bacteria is called, okay, chemotaxis. Chemotaxis is directional movement. Right. Next, students. Rose-Waller test is positive in. Rose-Waller test is positive in rheumatoid arthritis. There are three types of arthritis. One which is called osteoarthritis, which is usually more common in aged patients. Rheumatoid arthritis, which is actually an autoimmune disorder. And there is one more arthritis called gouty arthritis. Gouty arthritis is because of the hyperuricemia. Okay, uric acid which forms accumulated between the joint space. Usually these type of patients will have morning stiffness, which is called as gouty arthritis. So this question, Rose-Waller test is for rheumatoid arthritis. Okay, but students remember, there is one more test called Rose-Bengal test. Rose-Bengal test is for Sjogren's syndrome. Okay. Right, students, remember, this is so important question. Jaundice. Jaundice is usually a very important question for MRB, TNPG. People likes this question very much. Love these questions. So we can expect even 2025 la kuda jaundice la ஒரு question expect பண்ணலாம். Okay, இந்த questionல என்ன கேட்டிருக்காங்கன்னா bilirubin metabolismல which of the following is true? Okay, fecus contain cerebilin, correcta? Fecus usually contains scopobilin. Okay, but answer is wrong. Okay, conjugated bilirubin is colorless. No, students. Unconjugated bilirubin is colorless. Conjugated bilirubin is color. Okay, so this is also wrong. Okay, and unconjugated bilirubin is soluble in water. Absolutely no, students. Conjugated bilirubin is usually soluble in the water. And what is excreted in the urine also conjugated bilirubin. So fourth option also absolutely wrong. So that's why we go for the second option. Hepatocytes oxidize heme to biliverdin. Right, students. So next. What is the chief reservoir for calcium and phosphorus? Obviously, what is skeletal muscle? Skeletal muscle which contain good amount of skeletal tissue, not muscle, skeletal tissue, that is bone. Okay, skeletal tissue which contain good amount of calcium. Okay, students remember, எவ்வளவு calcium இருக்கும் போன்ல டீத்ல இதெல்லாம் எவ்வளவு calcium இருக்கும் அப்ராக்சிமேட்டா? இது கூட ஒரு क्वेश्चन கேட்கலாம். Okay, calcium metabolismல physiology bookல எடுத்து பாத்தீங்கன்னா first line கொடுத்திருப்பாங்க. Approximately 1 kilogram of calcium present in the bone and the tooth. So the answer for this is skeletal tissue. Okay, right. Next question, students. Which of the following proteins cannot be produced by the liver? Liver produces albumin, okay, prothrombin, fibrinogen, but students, gamma globulin is not the answer because gamma globulin is nothing but immunoglobulin. Immunoglobulin is produced by the plasma cells. Okay, so that's why we go for this option C. Okay, and can you say what is the cancer of the plasma cell is called as? What is the cancer of the plasma cells is called as? Is the cancer of plasma cells is multiple myeloma? And the question is about multiple myeloma. What is the histological picture? The histological picture of the multiple myeloma is cartwheel appearance. What is the meaning of cartwheel appearance, students? Cartwheel appearance அப்படின்னா நியூக்ளியஸ் வந்து எசென்ட்ரிக்கா இருக்கும். அதுக்கு பேர் தான் cartwheel appearance. வெளியில தள்ளி இருக்கும். ஏன் அப்படின்னா பிளாஸ்மா செல்ஸோட ஃபீச்சரே அப்படிதான். நியூக்ளியஸ் இஸ் எசென்ட்ரிக். Okay, so students, next question. The largest amount of vitamin C is occurring in the adrenal cortex. Yes, easy. Just straightforward, fact-based question. So growth hormone is also called as, somatotrophin. Usually this somatotrophin which acts in the bone or other tissue through a mediator. That mediator is called as somatomedin. Okay, somatomedin is the mediator. Somatostatin, statin means what? Block, decrease. So somatostatin which actually decrease the growth. Okay, somatotrophin is the other name. Okay, and you have to know what is if the growth hormone is decreased in children, adult, all this. Right, students, what is the reliable screening test for platelet function? This is the key word, student. Platelet function means what? Clot retraction. Similarly, if they ask you platelet count and caterda, Answer A where. Okay. So, and students, next question. Cytokines are endogenous signal that stimulate all except. What is the cytokines? Cytokines are nothing but interleukins. What does mean interleukins, students? Interleukins அப்படின்னா என்ன? Interleukins அப்படின்னா நம்ம ரெண்டு பேர் பேசிட்டு இருக்கோம் இல்லையா? ஓகே, இல்லைன்னா அது ஒன் வே கம்யூனிகேஷன். இப்போ யாரும் ரெண்டு பேர் பேசிட்டு இருக்குன்னு வச்சுக்கோம். அதே மாதிரி ஸோ பாக்டீரியா ஒன்னோட ஒன்று பேசிக்கும், WBC ஒன்னோட ஒன்று பேசிக்கும். ஓகேவா? ஸோ இது பாக்டீரியா ஒன்னோட ஒன்று பேசிடுச்சுன்னா அதுக்கு பேரு குவாரம் சென்சிங் படிச்சிருக்கோமா? பெரியோட ஞாபகம் இருக்கா? ரைட். இதே மாதிரி WBC ஒன்னோட ஒன்று பேசிக்கும். எந்த மாலிகுல் வழியா? which is called interleukin. What is the meaning of leukin? Leukin means WBC. Inter means communicating the two WBC, which is called interleukin. That is called cytokines. Usually these cytokines, okay, that stimulate all except கேட்டிருக்காங்க students. Answer is I will go for actually this question. All these are correct. Local cell proliferation is correct. Production of acute phase protein is correct. It will act on the CNS to produce fever is correct. It also causes septic shock. Okay, all the four options are correct. All these four are function of the cytokine. அப்ப நான் எங்க போகலாம் அப்படின்னா probably septic shock actually correct only. So I preferably to go for which option அப்படின்னா கேட்டா this is the least preferable option I can go for. But all these four is the function of the cytokine, students. Okay, so the answer is not septic shock. Answer is A. Excuse me. Okay, the next question. What is called as flash clave? Flash clave for an autoclave consists of. Flash clave means what? Anything which is done in the rapid method is called flash. Okay, so flash clave means the temperature is usually 134 degrees Celsius for 3 minutes. Okay. So students, what is the normal temperature of autoclave? The normal temperature of autoclave is 121 degrees Celsius for 15 minutes. இங்க flash clave னு கேட்டிருக்காங்க, அதனால we go for 134 degrees Celsius for 3 minutes. So next question. Kattapercha can be effectively sterilized by. Kattapercha usually sterilized by 5.2% sodium hypochlorite for 1 minute. So we can go for this one, which is called chemical solution. And what is for hard salt sterilizer? Hard salt sterilizer is called as glass bead sterilizer. Either you can use glass bead or hard salt. Okay, which is for usually files and reamers. Okay, சின்ன instruments இருக்கு இல்லையா? So அந்த மாதிரி instrumentsக்கு hard salt sterilizer யூஸ் பண்ணலாம். And dry heat for usually for the glassware. Okay, so right. And what is gamma 2 phase? Tin mercury phase is called gamma 2 phase. So answer for this is option A. And silver mercury phase is called gamma 1 phase. Okay. The chaos of phase angle for the cast metal restoration. Cast metal restoration, they're talking about inlay, right? So for inlay, what is the chaos of phase angle means? 140 degree. 140. What about 90 degree? 90 degree is for amalgam. Okay, right. What is called the chaos of phase? Chaos of phase அப்படினா, okay, the tooth ஓட end margin இருக்கு, அதுவும் external surface meet பண்ற இடம் தான் chaos of phase. Usually metal it is around 140 degree. Right, student, this is the question. Just keep on asking in many exams. Okay, the question of even I think this question is asked in the recent NEET exam also. Okay, so they're talking about radial line, rake phase, all this. So students, this is the burr. This is the burr which has many blade. I'm taking only one blade. I'm just drawing a line, central line, which is called as radial line. Okay, so this is the surface when it rotates. Okay, so this is called rake phase. This is called rake phase. This is called clearance phase. Students, remember, when the rake faces rake faces ahead of the radial line or radius of the burr, what is this is called? Negative rake angle. Students, so important. Rake face radial line க்கு முன்னாடி இருந்துச்சுன்னா negative rake angle. In the rake face when the radial line க்கு பின்னாடி இருந்துச்சுன்னா which is called as positive rake angle. Okay, so answer for this is negative rake angle. And most of our dental burrs are made up of negative rake angle only. Okay, negative rake angle usually என்ன ஆகும்னா burrs வந்து blades வந்து உடையாது. அதனால தான் most of the burrs are negative rake angle. Right. So students, wear of the tooth surface by chemico-mechanical action. What is the meaning of chemico? Chemico அப்படினாலே erosion. Okay, chemical, gastroesophageal reflex, acid. So mostly palatal surface of the incisors are affected in the erosion. What is called attrition? Attrition is opposite teeth ஓட contact ஆவதனால வச்சு நடக்கிறது attrition. Abrasion அப்படின்னா tooth brush வச்சு பண்றது abrasion. Abrasionனால எந்த tooth surface affect ஆகும்? Attritionனால usually occlusal surface. Okay, abrasion usually cervical region you have something called V-shaped defect. Affraction அப்படின்றது again high occlusal load and the cervical region இருக்க tooth மட்டும் கட்டாயி வெளியில வந்துரும். Okay, அதுக்கு பேர் என்ன சொல்லுவாங்க அப்படின்னா flexural stress னு சொல்லுவாங்க. அப்படி கட்டாயி வெளியில வந்துருச்சு அப்படின்னா இந்த இடத்துல ஒரு wedge shape defect இருக்கும். எங்க cervical regionல wedge shape defect இருந்துச்சுன்னா அதுக்கு பேர் affraction. V shape defect இருந்துச்சுன்னா abrasion. Students, புரியுதா? இதுதான் difference between attrition, abrasion, erosion, all this. Right. Tooth prepare பண்றப்ப GAC-க்கு என்ன கண்டிஷனர் யூஸ் பண்ணுவோம்? Answer is what? 10% polyacrylic acid. So GAC has chemical bond to the tooth structure. So அந்த chemical bondக்கு நல்லா பெட்டரா chemical bond கொடுக்கணும் அப்படின்னா மேல இருக்க smear layer ரிமூவ் பண்ணணும். மேல இருக்க smear layer ரிமூவ் பண்றதுக்கு என்ன கண்டிஷனர் இஸ் பெஸ்ட் அப்படின்னு கேட்டா 10% polyacrylic acid is best. Right. So coming to the next part. Phosphate investments are used for base metal alloy. Gypsum investment is used for the gold alloys. There are three types of investment material. One which is called gypsum bonded, phosphate bonded, silicate bonded. Gypsum bonded gold use பண்ணுவாங்க, phosphate bonded, silicate bonded, base metal alloys use பண்ணுவாங்க. இதே question இப்போ ரீசெண்டா நீட் எக்ஸாம்ஸ்ல கேட்டிருந்தாங்க. என்ன கேட்டிருந்தாங்கன்னா high fusing alloy, high fusing base metal alloy அப்படின்னா என்ன அர்த்தம்னா எந்த பேஸ்மெண்ட் அலைஸ்க்கு மெல்டிங் பாயிண்ட் அதிகமா இருக்கும் அதுக்கு என்ன இன்வெஸ்ட்மெண்ட் யூஸ் பண்ணுவீங்கன்னு கேட்டா சிலிகேட் இன்வெஸ்ட்மெண்ட். அண்ட் ஸ்டூடெண்ட்ஸ், there is one more very important question for a silicate investment. There is something called green shrinkage associated with which investment கேட்டா that is also silicate investment. What is called green shrinkage? Green shrinkage அப்படின்னா அந்த இன்வெஸ்ட்மெண்ட்ல ஹீட் பண்றப்ப அதில் இருக்க ஆல்கஹாலும் வாட்டரும் எவாபரேட் ஆகிறதுனால அந்த இன்வெஸ்ட்மெண்ட் லைட்டா ஸ்ட்ரிங்க் ஆகும். That is called green shrinkage. Remember, green shrinkage is associated with what investment? Silicate bonded investment. Right. Carat, gold. இல்லையா? கோல்டுன்னு சொன்னாலே எனக்கு டைமா இருக்குல்ல. ஸோ கோல்டோட ரேட்டு ராக்கெட் மாதிரி மேலே போயிட்டு இருக்கு இல்லையா? நம்ம நினச்சா கூட வாங்க முடியாது போல. ஸோ அந்த அளவுக்கு பயங்கர கோல்டு ரேட் போயிட்டு இருக்கு. ரைட். வாட் இஸ் கேரட்? கோல்டோட பியூரிட்டியை மெஷர் பண்ணுறதுக்காக யூஸ் பண்ணுறது தான் கேரட் ஆக்சுவலாக. ஸோ யூஸ்வலாக கடையில் போயிட்டு நம்ம பியூர் கோல்டுன்னு கேட்டால் என்ன சொல்லுவாங்க? 24 கேரட் கொடுப்பாங்க. ஓகே, இப்போ டென்டிஸ்டியில் கேரட் யூஸ் பண்ணுறோமான்னு கேட்டால் நோ. டென்டிஸ்டியில் யூஸ்வலாக வில் பி மெஷரிங் த பியூரிட்டி ஆஃப் த கோல்டு பை யூனிட் கால்ட் அஸ் ஃபைனஸ். அப்போ எவ்வளோ ஃபைனஸ் இருந்துச்சுன்னா பியூர் கோல்டு அப்படின்னு கேட்டால் 1000 ஃபைனஸ். கேட்கலாமா? ரைட். நெக்ஸ்ட் கொஸ்டின். ஓகே, ரைட். நெக்ஸ்ட் கொஸ்டின். The patient is having aesthetic and structural integrity were disregarded. Okay, and ideal location for the access cavity preparation of RCT of the maxillary permanent central incisor. Okay, so அப்ப நார்மலா ஒரு maxillary central incisor-க்கு நம்ம ஆக்சஸ் கொடுக்கறப்ப எங்க பண்ணுவோம்? சிங்குலம்ல கொடுப்போம், இல்ல சிங்குலம்க்கு கொஞ்சம் மேல, தட் இஸ் palatal surface-ல கொடுப்போம். பட் இந்த இடத்துல ஸ்ட்ரக்சரல் இன்டெகிரிட்டி கொஞ்சம் கம்மியா இருக்கு. ஈஸ்தட்டிக்ஸ் இதெல்லாம் நம்மளுக்கு வேண்டாம் அப்படின்னு நம்ம நினைக்கிறப்ப என்ன பண்ணலாம்? ஈஸ்தட்டிக்ஸோ ஸ்ட்ரக்சரல் இன்டெகிரிட்டியோ வேண்டாம் அப்படின்றப்ப ஸோ அண்ட் ப்ரிஃபரபிள் ஆன்சர் இஸ் வாட்? த்ரூ த இன்சைசல் எட்ஜ். So depends upon the question you have to be answered. Right. Students, what is the powder liquid ratio for the GAC? GAC is otherwise called as dentine substitute. Okay, so otherwise called as man-made dentine. So the answer for this is 3:1 to 4:1. இதே 3:1 multiple areas நம்ம படிப்போம். எங்கெங்க படிப்போம்? denture based resin ஓட powder liquid ratio படிப்போம். MTO ஓட powder liquid ratio 3:1. So yes students, next question. What is the golden period for the treatment of open wound? Golden period for the treatment of open wound is 4 hours. இது கொஞ்சம் கான்ட்ரவர்ஷியல் கொஸ்டின். சில புக்ஸ்ல 6 hours கொடுத்துருப்பாங்க, பட் அக்கார்டிங் டு மீ இட் இஸ் 4 hours. வெறும் கோல்டன் பீரியட்னு கேட்டா, கோல்டன் பீரியட் மட்டும் கேட்டாங்கன்னா 1 hour. ஓகே, கோல்டன் பீரியட்னா யூஸ்வலா ஸ்ட்ரோக்கோ இல்லை மயப்பொருள் இன்ஃபெக்ஷனோ இருக்கிறப்ப விச் இஸ் த பெஸ்ட் டைம் டு பிரிங் த பேஷண்ட். ஓகே, எவ்வளவு நேரத்துக்குள்ள கொண்டு போனா குட்னு கேட்டா, ஸோ தட் இஸ் ஓகே. So the next question is about massive blood transfusion கொடுக்கறப்ப என்ன காம்ப்ளிகேஷன் நடக்கலாம்? ஓகே, massive blood transfusion கொடுக்கறப்ப ஸ்டூடெண்ட்ஸ் ரிமெம்பர் ஹைப்பர்கலிமியா இருக்கும். ஸ்டூடெண்ட்ஸ் ஹைப்பர்கலிமியா, ஏன் ஹைப்பர்கலிமியா இருக்கு அப்படின்னு யூஸ்வலா இந்த செல்லுக்குள்ள இருக்கிற ஒரு மேஜர் மாலிக்யூல் என்ன அப்படின்னா பொட்டாசியம். ஸோ என்ன ஆகும்னா பிளட் டிரான்ஸ்மிஷன் கொடுக்குறப்ப நிறைய ஆர்பிசி பிரேக் ஆகும். பிரேக் ஆகிறதுனால பொட்டாசியம் will come out, which is called which causes hyperkalemia and causes hypocalcemia. Okay, but what is the answer for the students? The answer for this is coagulopathy. What is called coagulopathy? Coagulopathy is simply it is called a bleeding disorder. Usually ஒரு stored bloodல factor 5 8 கம்மியாகும், அதனால bleeding disorders இருக்கும். So that's why we go for the coagulopathy. Right. Students, what is a suitable match? Okay, so usually leaf 4 to 1 osteotomy நம்ம எதுக்கு பண்ணுவோம் அப்படின்னா orthognathic surgery பண்ணுவோம். So to reposition the maxilla. And what is the landmark for the administration of inferior lobe block using the DAG technique? Students சொல்லலாமா? Easy question. Caroline arch and pterygomandibular fold. So இது பார்க்கறதுக்குலாம் ஒரே மாதிரி இருக்கும், அதனால கொஞ்சம் so which are to the otherwise so answer this we can go for height. Genioplasty என்ன பண்ணுவோம்? Okay, genioplasty right. Genioplasty is done in the mandibular excess. Usually, when we go for the chin size of length of the chin, we go for the genioplasty, students. So mandibular excess. Right, students. Next question: parallax method of determining the tooth position. Okay, so what is this question they are talking about? This question they are talking about slab rule. Okay, so students remember the slab rule is also one more important topic for you. Slab rule, otherwise called as Clark rule, otherwise called as tube shift technique. Right. So என்ன சொல்றாங்கன்னா இந்த tooth வந்து moves in the same direction. எக்ஸ்ரே டியூப் எந்த டைரக்ஷன்ல மூவ் ஆகுதோ அதே டைரக்ஷன்ல டூத் மூவ் ஆகுது. அப்ப எங்க இருக்கும் டூத், எங்க இருக்கும் அப்படின்னு கேட்கறாரு. ஒரே டைரக்ஷன்ல மூவ் ஆச்சுன்னா அது என்னது? சேம் சைட் லிங்குவல். அப்ப டூத் எங்க இருக்குன்னு அர்த்தம்? லிங்குவலா இருக்குன்னு அர்த்தம். செம்ம ஈஸியா palatally placed. What is called as tube shift technique. Right. Students, there is a question from the lignogai. Okay, calculation based. Even in 2025 you can expect these type of questions, students. Right. So students என்ன கேட்கலாம்? Okay, இந்த கொஸ்டின் பத்தி என்ன ஞாபகம் வச்சுக்கணும்? ஓகே, ஒரு கேட்ரிட்ஜ்ல 36 மில்லிகிராம் இருக்கு, லிக்னோகைன் இருக்கு, 1:1 lakh epinephrine. What is the maximum number of cartridge that can be safely injected in a patient? Okay, so this is the question. Usually ஒரு பேஷண்ட்டுக்கு எவ்வளவு லிக்னோகைன் கொடுக்கலாம் அப்படின்னா ஒரு 500 மில்லிகிராம் கொடுக்கலாம். ஓகே, பேஷண்ட்டுக்கு 500 மில்லிகிராம் வித் அட்ரினலின். வித்தவுட் அட்ரினலின் எவ்வளவு கொடுக்கலாம்னு கேட்டா 300 மில்லிகிராம். ஆனா இப்ப பேஷண்ட்டுக்கு நம்ம கொடுத்துருக்கிறது வித் எபினெஃப்ரைன், அப்ப 500 மில்லிகிராம். ஸ்டூடெண்ட்ஸ் ரிமெம்பர், ஒரு கேட்ரிட்ஜ்ல 36 மில்லிகிராம் இருக்குன்னா ஓகே, அப்ப எத்தனை கேட்ரிட்ஜ்? 500 மில்லிகிராம். 500 மில்லிகிராம் அப்படின்னா எத்தனை கேட்ரிட்ஜ்? ஓகே, எக்ஸ் வச்சுக்கலாமா? எத்தனை கேட்ரிட்ஜ்? எக்ஸ் தான் நம்மளுக்கு வேணும். ஓகே, எத்தனை கேட்ரிட்ஜ்ல 500 மில்லிகிராம் இருக்கும்? ஓகே, இப்போ கால்குலேட் பண்ணலாமா? ஓகே, எக்ஸ் இன்டூ 36 ஈக்குவல் டு 500. அப்போ எக்ஸ் வேணும் அப்படின்னா ஓகே 500 by 36. So approximately if you calculate, it will come around 14. Okay, so the answer for this question is 14, students. This is how you have to be calculate. Students remember, lignogain with adrenaline, the maximum dose is 500 milligram. Without adrenaline, it is 300 milligram. Okay, இது இல்லாம ஃபார்முலா இருக்கா? ஞாபகம் வச்சுக்கலாமா? with adrenaline அப்படின்னா 7 milligram per kilogram body weight. So patient ஓட weight 10 kilogram அப்படின்னா எவ்வளவு கொடுக்கலாம்? 70 milligram கொடுக்கலாம். இவ்வளவுதான். And without adrenaline அப்படின்னா 4.4 milligram per kilogram. Easy. 10 kilogram எவ்வளவு கொடுக்கலாம்? Okay, 44 milligram கொடுக்கலாம். Maximum dose. இவ்வளவுதான் students. Sum simple. இதை பேஸ் பண்ணி you can expect a question in your 2025 also. All right. Student, the next question. Which of the following statement is a correct statement about the coagulation? Okay. So answer is the second option. PT is the most common test used for measuring the anticoagulant therapy. That is prothrombin. So usually you have to know some important points related to here, which is called PT and PTT. PT is what? PTT is what? In a coagulation, you have two type of pathway, like intrinsic pathway and extrinsic pathway. Intrinsic pathway la enna check பண்ணுவோம்? Okay, PTT is check. Extrinsic pathway la, okay, extrinsic pathway la you will be checking PT. Okay, and students, next one, when you go for a suturing, the suture needle should enter the tissue at what degree means? Obviously the 90 degree, right? 90 degree, right? Next question, oral hygiene index. Oral hygiene index. So what are the tooth will go for indexation? That is called incisors and molars. Usually will go for the oral hygiene index. And students, let's go through some important index like the Russell's index, OHI index, Flock index. இதெல்லாம் யார் சொல்லியிருக்காங்க என்னென்ன டூத் பண்ணும் அது மட்டும் கொஞ்சம் எக்ஸாம் போகிறதுக்கு முன்னாடி go through பண்ணிக்கங்க. Right. Student, the next question. Which are the following bristle which has the least amount of gingival irritation? Least in கேட்டா நம்ம என்ன போலாம்? Round end போலாமா? Easy-ஆ? Okay, right. Next one. What is deductible otherwise called as? Deductible otherwise called as co-insurance. Sorry. Deductible, I think so. Just a minute, student. We'll check. So students, deductible means answer is front-end payment. It is not co-insurance. Okay, please check it. Okay, right. What is the feature of localized aggressive periodontitis? Okay, localized aggressive periodontitis, usually the patient does not have any inflammation. So you will be having something called as mirror bone loss, especially around the first molar. So, but the patient does not have any inflammation. That is the very important feature of aggressive periodontitis. Right. Most prevalent type of gingival changes in childhood is usually childhood children, they won't have periodontitis. Okay, so the answer is chronic marginal gingivitis. Only the marginal gingivitis is more common in children. And after curettage, reepithelialization occurs in 1 week. Just a fact-based question. Okay. Next is the child first dental visit. Usually, என்ன சொல்லுவோம் அப்படின்னா ஃபர்ஸ்ட் சைல்டு டென்டல் விசிட் வந்து எப்போ ஃபர்ஸ்ட் டூத் எரப்ட் ஆகுதோ தட் இஸ் த ஃபர்ஸ்ட் டென்டல் விசிட் நம்ம சொல்லுவோம். ஃபர்ஸ்ட் அப்போ 6 months சொல்லலாமா? பட் 6 months which is not in the option. அதனால we can go for what? 1 year of age. Leeway space helps in the development of normal occlusion by. Okay, answer is correct. Yes, correct. It is correct. So answer is all of this. Okay, students, next is, again, it is a little controversial question, students. Enamel hypoplasia is because of the disturbance of, okay, enamel hypoplasia, which had happening in the histodifferentiation, morphodifferentiation, apposition, all this. Okay, but my answer for this question is histodifferentiation. Okay, and if you want to go with a pulse means you can go for apposition, right? So next, what is called a glabella? Glabella is the most prominent point on the forehead is called as glabella. Dentigerous cyst is more common in second decade. Okay, second and third decade. If you want to go between the second and third decade, you can go for the second decade. Dentigerous cyst is called as follicular cyst, which is most commonly associated with impacted teeth. And so second decade is more common. So students, second decade. Okay, dilaceration is all the following except. Dilaceration, yes, there is a bend in the, suppose if this is the tooth. Okay, if there is a root, there is a bend in the root. Okay, there is a bend in the root. Okay, this root is usually at the end. Okay, not between the junction of the crown and root. Crown ku root ku nadula bend irukuman ketta kedaiyadhu. Root end la da and the bend irukum. Appo students, it is absolutely wrong. So answer is B. Answer is B. Okay, change the answer. Answer is B. Okay, next question. The two or more tooth united by the cementum is designated as, it is called as concrescence. It's called concrescence. Right, next question. Ameloblastoma is epithelial in origin. And what is the definition of the ameloblastoma? Uniac, unicentric, non-functional, intermittent in growth, anatomically benign, clinically persistent. So we can go for uniac. Right. Pink tooth is an easy question. Pink tooth is called internal resorption. There is a resorption by the odontoclast. So internal resorption, otherwise called as odontoclastoma. Odontoclastoma. What is this? Chronic hyperplastic pulpitis. Chronic hyperplastic pulpitis, otherwise called as pulp polyp. Right. Students, next, which is having the maximum osteogenic potential? Okay, so for students, you have to know what is called autograft, allograft, xenograft. Autograft is by the own person. Okay, so myself to myself, which is called autograft. Okay, so same species, one human to another human being is called as allograft. Okay, and different species is called xenograft. Okay, whether autogenous cortical or cancellous, which has most osteogenic, means I can go for autogenous cancellous, which has more osteogenic potential. Students, book இன்னொரு graft என்னன்னா orthoptic graft. What is called orthoptic graft is means same anatomical site. Palate இருந்து எடுத்து palate இன்னொரு இடத்துல வைக்கிறதுக்கு பேரு orthoptic graft. Right. Next question, students. What is called osteointegration? The osteointegration is the connection between the bone and the implant is called as osteointegration. So we can go for option C. Pyramidal type of fracture, which is usually happened in the Leaford type 2 fracture, otherwise called as pyramidal fracture. Okay. Students, this is again a tricky question. Buccal cortical plate fracture occurs most commonly during the extraction of, okay, permanent canina, permanent molara. Okay, இது கொஞ்சம் tricky question, but examiner என்ன select பண்றாங்கன்னு நம்மளுக்கு தெரியாது. Okay, so what when I discussed about with a surgeon is they told both are correct. Okay, so but உங்களோட பல்ஸ்ல என்ன கொடுத்திருக்காங்கன்னு கேட்டா அப்பர் ஃபர்ஸ்ட் பெர்மனன்ட் மோலார் கொடுத்துருக்காங்க, அப்பர் பெர்மனன்ட் கெனைன் கொடுக்கல. ஏன் கெனைன்ல காமனாக பக்கல் பிளேட் எக்ஸ்ட்ராக்ட் ஆகும்னு கேட்டால் யூஸ்வலாக கெனைன் ப்ரொட்யூபரன்ஸ் இருக்கும். கெனைன் ப்ரொட்யூபரன்ஸ்ல அந்த இடத்துல பக்கல் பிளேட் வந்து ரொம்ப தின்னாக இருக்கும். ஓகே, அதனால பக்கல் பிளேட் ஈஸியாக ஃப்ராக்சர் ஆகும் கெனைன் எக்ஸ்ட்ராக்ட் பண்ணுறப்ப. பட் மோஸ்ட் காமன் நம்ம கேட்குறப்ப கெனைன் யூஸ்வலாக எக்ஸ்ட்ராக்ட் பண்ண மாட்டோம். ஓகே, ஸோ மோலார் தான் எக்ஸ்ட்ராக்ட் பண்ணுவோம். ஸோ அப்போ வி கேன் கோ ஃபார் அப்பர் ஃபர்ஸ்ட் பெர்மனன்ட் மோலார். ஸோ என்ன கேட்டால் எம்ஆர்பி எக்ஸாமுக்கு ப்ரிஃபரபிளி யூ கேன் கோ ஃபார் ஆப்ஷன் ஏ பிகாஸ் தே வில் சூஸ் preferably from the pulse. Okay, Keta, we can go for option A. Right, students, the next one is about cavernous sinus thrombosis. Okay, which has happened when there is an infection in the maxillary anterior teeth. Maxillary anterior teeth la irundhu cavernous sinus ku eppadi infection transmit agunu kekranga. Yes, usually it is transmitted by the ophthalmic vein. Again, cavernous sinus is one of the so important topic for your MRB exam. Okay, where is the cavernous sinus located? Where is the anterior relation, posterior relation, inferior relation, superior relation, medial relation, lateral relation? And what are the coming structure, incoming structure, outgoing structure, everything related to the cavernous sinus is so important for your MRB exam. Right, students, the next question. Okay, there is a second pharyngeal pouch and a cleft persist. Okay, and what is this is called as persistent of the second pharyngeal pouch. Okay. And this is called branchial cyst. ஆனா எக்ஸ்ட்ரா ஒரு கொஸ்டின் கொடுத்துருக்காங்களா, பிரேக் ஆயிருக்கும். அப்ப நம்ம என்ன போலாம், branchial fistula போலாமா? So students, next question, which of the following is the not a branch of, sorry, which of the following is not a branch of second part of the maxillary artery? So maxillary artery usually have three parts: first part, second part, third part. First part, which muscle divides the maxillary artery into three parts? Lateral pterygoid. So second part usually supplies for muscles of mastication. So muscles of mastication temporalis. So supply the deep temporal artery. So we can go for this. Students, any doubt till now? If doubt irundhuchu appadina Yes, என்னோட நம்பருக்கு மெசேஜ் பண்ணுங்க. Whoever it is. Okay, it is not necessary to be ArdentMDS student. Whoever it may be preparing for MRB. Okay, so message me. I will be given the clearance for you. Okay, or you can give it in the chat session of your YouTube itself. Okay, நான் உங்களுக்கு ஆன்சர் பண்றேன். So next question, which are the following nose has sensory and motor component? So answer is lingual. Okay, so answer is lingual, not mylohyoid. So students, the next question is about vitamin D. Vitamin D, which increases calcium and phosphorus absorption from the intestine. Vitamin D also act on the kidney to causes reabsorption. So we can go for option D. That is the better option. Okay, right. Students, next question is adrenaline. Adrenaline is usually synthesized from a molecule called noradrenaline. When the noradrenaline, adrenaline produce and the process methylation. Okay, first option demethylation, obviously wrong. It is metabolized by monoamine oxidase, correct student. Ana, plasma liver. Tricky question. Some tricky questions set decreased coronary blood flow. No, actually adrenaline emergency condition use பண்ணுவோம். So அதனால coronary blood flow increase ஆகணும். Actually patient will go for still more emergency. So mobilizes glycogen storage from the liver because adrenaline is the sympathetic system, right? அதோட neurotransmitter. அதனால adrenaline என்ன பண்ணும் அப்படின்னா யூசுவலா குளுக்கோஸை பிளட்டுக்கு கொண்டு வரும், லிவர்ல இருந்து பிளட்டுக்கு கொண்டு வரும். ஸோ கிளைகோஜன் லிவர்ல இருக்க கிளைகோஜனை பிளட்டுக்கு கொண்டு வரும். ஸோ ஆன்சர் இஸ் சி ஸ்டூடெண்ட்ஸ். What is the serological marker for acute serum hepatitis? This is asked in one of the very recent NEET exam also. So the answer is surface antigen, which is the serological marker. And usually hepatitis is so important topic for dentist. So for example, suppose if they ask you, what is the marker for vaccine? Hepatitis vaccine keta, anti-HBs. Anti-HBs. Okay. And what is called hepatitis E antigen? Envelope antigen அப்படின்னா என்னன்னா, the patient will have high infectivity, which is called, what is a marker in keta? Envelope antigen. Low infectivity in keta, anti-HB. Anti-HB. Okay. The core antibody la ரெண்டு டைப் இருக்கு ஸ்டூடெண்ட்ஸ். Okay, core antibody la IgM இருக்கு, IgG இருக்கு. Okay, IgM அப்படின்னா யூஸ்வலாவே எங்க இருக்கும் அப்படின்னா அக்யூட் இன்ஃபெக்ஷன்ல இருக்கும். IgG-னா chronic இன்ஃபெக்ஷன்ல இருக்கும். ஓகே, HBC ஆன்டிஜன் அப்படின்னா கோர் ஆன்டிஜன். கோர் ஆன்டிஜன் பிளட்ல பார்க்க முடியுமான்னு கேட்டா டெஃபினெட்லி நோ. ஏன்னா கோர் ஆன்டிஜன் இஸ் கவர்டு பை என்வலப். ஸோ அதனால நம்மளால பிளட்ல பார்க்க முடியாது. ஓகே, so students, next question. Okay, what is the stages of the cell cycle in occurs which are the following orders? Cell cycle என்ன அப்படின்னா, which is called Z0. Okay, it is called resting stage. So the order of cell cycle is resting stage, which is Z0. Z0, resting stage. G1, from there S phase, which is synthetic phase. Then it will go for G2, then the cell will divide, which is called mitosis. Okay, this is the order. So answer for this question is fourth option. Students, the next question. Where is the source of the systemic chemical mediators of inflammation? The source of the systemic chemical mediator of inflammation is liver. Okay, even cells at the site of injury which also produce chemical mediators. But students, remember, இது வந்து local. Systemic கேட்டிருக்கிறதுனால we can go for liver. So அதனால option A. Students, how do you differentiate a malignant tumor from the benign tumor? Obviously, the very easy question. Answer is metastasis. Malignant tumor will go for metastasis. Benign tumor does not go for metastasis. But students, remember, one tumor, one cancer which does not go for metastasis that much easily. Which tumor? Which malignancy? Yes. The answer is basal cell carcinoma. Does not go for much metastasis. That's why basal cell carcinoma, otherwise called as benign carcinoma. Okay. And there is a question also related to the basal cell carcinoma where it will develop. The most common site of the basal cell carcinoma is the middle third of the face, especially related to the lip. Okay, lip, you have two parts of the lip. cutaneous part of the lip and mucosal type of the mucosal side of the lip. But the answer is most common related to the cutaneous and the basal cell carcinoma. In a etiological factor ni keta UV rays. UV rays la rendu type irukku UVA, UVB. அப்ப எதுன்னு கேட்டா UVB is the answer. Right. B for bad. நான் வச்சுக்கலாமா? B for bad. Right. Students, next question. Which of the following patients require antibiotic prophylaxis before surgery? Answer is rheumatic carditis. Okay, usually நம்ம என்ன பண்ணுவோம்? இது ரொம்ப important question students. ஒரு patient வந்து ஒரு சர்ஜரிக்கோ இல்ல எக்ஸ்ட்ராக்ஷனுக்கோ வராங்க அப்படின்னா before you do the dental procedure, especially for a cardiac patient, especially for the patient who have rheumatic carditis, so you have to give the prophylaxis, antibiotic prophylaxis. என்ன tablet கொடுப்போம்? என்ன antibiotic கொடுப்போம் அப்படின்னு கேட்டா amoxicillin எவ்வளவு கொடுப்போம்? 2 gram 1 hour before procedure. படிச்சிருக்கீங்க இல்லையா? So இதே ஓரலா எடுத்துக்க முடியலன்னா patient can go for ampicillin. Okay, so students, answer is rheumatic carditis. Students, what is called parts 2 operation? Okay, parts 2 operation means something called enucleation. Okay, and parts 1 அப்படினா marsupialization. Okay, yes students, next question. Trismus is during extraction most likely result of, yes, the answer is medial pterygoid muscle. This is NEET 2025 question. இந்த வருஷம் கேட்டிருக்க question actually 2010 நமக்கு TN MRB கேட்டாங்க. Okay, right. Students, next question. What is the correct temperature of the holding time of autoclave? Autoclave வந்து ரெண்டு question கேட்டிருக்காங்க MRB. Autoclave is so important topic. 121 degrees Celsius for 15 minutes. And students, remember, autoclave என்ன biological indicator use பண்ணலாம்னு கேட்டா there is an indicator called bacteroids stereothermophilus. Remember, this is called bacteroids stereothermophilus, which is the biological indicator for the autoclave. இதே மாதிரி hot air ovenக்கு என்ன biological indicator னு கேட்டா which is called Clostridium tetani. Okay, Clostridium tetani. என்ன Clostridium tetani? Spores of Clostridium tetani, non-toxigenic strains of Clostridium tetani, which is the biological indicator for the hot air oven. Right, students, ஒரு சைல்டுக்கு ஆஸ்பிரின் கொடுக்கறப்ப எஸ்பெஷலி வைரல் இன்ஃபெக்ஷன், வேரிசெலா இன்ஃபெக்ஷன், ஓகே, வேரிசெலா ஜோஸ்டர் தெரியும் இல்லையா, ஹெர்பிஸ் டைப் 3, வேரிசெலா எப்பவுமே ஒரு வைரல் இன்ஃபெக்ஷன் இருக்கிறப்ப ஆஸ்பிரின் கொடுக்க கூடாது. ஓகே, எஸ்பெஷலி ஃபார் சில்ட்ரன்ஸ். என்ன கொடுத்தா என்ன ஆகும்? அதுதான் கொஸ்டின். கொடுத்தா என்ன ஆகும்னா பேஷண்ட் கெட் வாட்? ரே சிண்ட்ரோம். ஓகே, வாட் இஸ் கால்ட் ராம்சே-ஹண்ட் சிண்ட்ரோம். Ramsay-Hunt syndrome அப்படின்னா suppose a patient is getting herpes zoster which involves the geniculate ganglion. Geniculate ganglion என்ன? Facial node ganglion. அப்ப patient will get facial paralysis. So this is what called as Ramsay-Hunt syndrome. Even simply they may ask you Hunt syndrome னு கூட கேட்கலாம். Right, students? So next question. What is talysm otherwise called as? Talysm means what? Increased salivary secretion, otherwise called as what? Siluria. All right, student, the residual biological damage even after exposed to the radiation is called as cumulative effect. Okay, and students, this is a very important question. Macroglacia. Macroglacia is congenital in origin. Yes, yeah, congenital origin. There is something called Beckwith-Weidman syndrome. Syndrome le patient ku macroglacia irukum, appa congenital nu sollalam. Tumor la tongue பெருசாகுமா? Yes, பெருசா இருக்கலாம். அப்ப tumor. Feature of acromegaly, obviously. Okay, we can go for what? All of this. Okay, in the condition macroglacia A, B, C, D. Na vachukkalama. A for acromegaly, B for Beckwith-Weidman syndrome, C for cretinism, D for Down syndrome. These conditions we can see the macroglacia. Right, students, Christmas disease is characterized by the prolonged clotting time. What is called Christmas disease? Christmas disease அப்படின்னா factor 9 deficient இருந்துச்சுன்னா which is called Christmas disease. Factor 8 deficient இருந்துச்சுன்னா which is called as hemophilia A. Hemophilia A, this is hemophilia B. And what is called hemophilia C? Hemophilia C is factor 11 deficiency. What is called parahemophilia? Parahemophilia is factor 5. And what is called vascular hemophilia? Vascular hemophilia is von Willebrand's disease. These are the different types of hemophilia you should know. Right, students, the next one, ஹைப்போலிமிக் ஷாக்ல என்னென்ன ஃபீச்சர்ஸ் இருக்காது, எந்த ஃபீச்சர்ஸ் இருக்காதுன்னு கேட்டிருக்காங்க. ஹைப்போலிமிக் ஷாக்ல யூஸ்வலா டாக்கிகார்டியா இருக்கும், பிளட் லாஸ் இருக்கு, அதனால அதோட காம்பன்சேட் பண்றதுக்கு டாக்கிகார்டியா இருக்கும். என்ன இருக்காதுன்னு கேட்டா பிராடிகார்டியா இஸ் அப்சென்ட் இன் எ hypovolemic shock. Hypovolemic shock is again very important topic. Even septic shock also very important topic. என்ன கொஸ்டின் கேட்கலாம் ஹைப்போலெமிக் ஷாக்ல? ஹைப்போலெமிக் ஷாக்ல எத்தனை பர்சன்டேஜ்க்கு மேல பிளட் லாஸ் இருந்துச்சுன்னா பேஷண்ட் வில் கெட் சிவியர் கண்டிஷன், worsening கண்டிஷன் அப்படின்னு கேட்டா 40%க்கு மேல. செப்டிக் ஷாக் which is caused by gram பாசிட்டிவா gram நெகட்டிவான்னு கேட்டா mostly it is caused by gram negative organism. Right students, neural crest cells which gives rise to all the following structure except, இது எல்லாமே neural crest derivative except enamel. Okay, so answer is A. So enamel is derived from the ectoderm. Right. So students, next question. The reduced enamel epithelium with which layer forms the Nasmyth membrane? So answer is oral epithelium. So students, next question. What about Meckel's cartilage? Meckel's cartilage usually develops for the mandible, dissolutes with minor contribution to the ossification. This is the Meckel's cartilage. Right students, lacrimal gland is supplied by, okay, usually ஒரு கேங்லியன் வழியாக ஒரு கிளாண்டுக்கு சப்ளை பண்ண முடியும் இல்லையா? சப்மாண்டிபுலர் கிளாண்டா இருந்தாலும் சரி, பரோட்டிட் கிளாண்டா இருந்தாலும் சரி, ஒரு கிளாண்டு வழி ஒரு கேங்லியன் வழியாக சப்ளை பண்ண முடியும். எந்த கேங்லியான் ஒரு ரிலே சென்டரா இருக்கும் லாக்ரிமல் கிளாண்டுக்கு? ஓகே, ஒரு ப்ரீ கேங்லியானிக் ஃபைபர் which goes to relay in some ganglion called pterygopalatine ganglion, otherwise called as sphenopalatine ganglion. Post ganglionic fibers from the sphenopalatine ganglion supplies for the lacrimal gland. So answer வந்து C, submandibular ganglion is submandibular gland. Okay students, OT ganglion is for parotid gland. Okay, which of the following does not describe a synovial joint? The answer is mucous fluid. Okay, fibrocartilage இருக்கும், joint cavity இருக்கும், capsule இருக்கும், usually synovial fluid இருக்கும், which is not mucous fluid. So, and this is also very frequently asked question. And where is the Langerhans cells are located? The Langerhans cells are located in, which is called stratum spinosum. Langerhans cells are located in stratum spinosum. Next question, question number 97. How do you diagnose a rotavirus? Some tricky question students. Okay, rotavirus ஏன் கேட்டிருக்காங்கன்னா, இப்பெல்லாம் most common cause for diarrhea is rotavirus. பழைய காலத்துல என்ன இருந்துச்சுன்னா காலரா. காலராவுக்காக நம்ம ஓஆர்எஸோட ஃபார்முலா இருக்கு இல்லையா, ஒரிஜினல் ஓஆர்எஸ் ஃபார்முலா காலராவை பேஸ் பண்ணி தான் கண்டுபிடிச்சாங்க. இப்போ அந்த ஓஆர்எஸ்ஸவே மாடிஃபை பண்ணிட்டாங்க, ஓரல் ரீஹைட்ரேட்டிங் சொல்யூஷனோட ஃபார்முலாவே மாடிஃபை பண்ணிட்டாங்க. எதை வச்சு மாடிஃபை பண்ணாங்க அப்படின்னா ரோட்டா வைரஸ்க்கு ஏற்ற மாதிரி மாடிஃபை பண்ணியிருக்காங்க. ஏன்னா மோஸ்ட் காமன் காஸ் ஃபார் த டயரியா இன் சில்ட்ரன் இஸ் ரோட்டா வைரஸ். ரோட்டா வைரஸை எப்படி டயக்னோசிஸ் பண்ணலாம் அப்படின்னு கேட்டால் எலிசா வச்சு டயக்னோஸ் பண்ணலாம். ஓகே, ஆனால் இங்கே ஆன்சர் எலிசா கிடையாது. ஓகே, ஏன் எலிசா கிடையாது அப்படின்னா செம்ம ட்ரிக்கி கொஸ்டின். எலிசா யூஸ் வர எங்க செக் பண்ணுவோம் அப்படின்னா, எலிசா வந்து ஆன்டிஜெனை டிட்டர்மைன் பண்றதுக்காக செக் பண்றதுக்காக தான் எலிசா செக் பண்ணுவோம். ஓகே, ஸோ பட் இங்க என்ன கொடுத்துருக்காங்கன்னா ஆன்டிபாடி. செம்ம ட்ரிக்கி இல்லை? ஓகே, அதனால ஆன்சர் இது எலிமினேட் பண்ணலாமா? ஸோ அப்போ வேற என்ன பெஸ்ட் ஆப்ஷன், வேற என்ன டயக்னோஸ்டிக் மெத்தட்? ஓகே, immunofluorescent antigen is one of the best method for the rotavirus. So we can go for answer C. Right, Schilling test. So Schilling test is for what? B12 malabsorption. So remember, Schiller's test is for carcinoma of the cervix. Skimmer test is for Sjogren syndrome. Skimmer's test is for Sjogren syndrome. Students, next question. Which are the following changes seen in the 5th day of the fasting? 5th day of the fasting, அப்ப என்ன ஆகும்னா, ஓகே, growth hormone increase ஆகும், insulin increase ஆகும், but the free fatty acid level will be higher. Okay, so answer is A. Gunning splint is used to fix to the mandible using what technique, which is called as circumferential. So till now we completed 100 questions, right? So right, students, the next 100 questions probably will be take 30 to 40 minutes more. Bonding in the porcelain, which is usually by two process, both chemical and mechanical. So என்ன பண்ணுவாங்கன்னா usually irregularities create பண்ணுவாங்க, அது வழியா bonding இருக்கும். And it usually happens with a chemical bonding also. Right, so next one, which are the following materials mistaken for the key design radiograph, which is calcium hydroxide. ஏன் calcium hydroxide அப்படின்னா Okay, those days calcium hydroxide is radiolucent. Okay, so calcium hydroxide கொடுக்குறப்ப radiolucent-ஆ இருக்கும், பார்க்கறதுக்கு கேடிஸ் மாதிரி இருக்கும். பட் இப்போலாம் calcium hydroxide ரேடியோ ஒப்பேக்கே வந்துருச்சு. பழைய கொஸ்டின் அப்படின்றதுனால we go for option A. Okay. So next question, what is the ideal retro preparation cavity depth? What is called retro preparation? Retro preparation அப்படின்றது root end cut பண்றது, that is called retro preparation. Usually எவ்வளோ கட் பண்ணுவாங்கன்னா 3 millimeter கட் பண்ணுவாங்க. ஏன்னா 3 millimeter தான் which has many good amount of your apical ramification, lateral canals, which are present in the 3 millimeter. So the best option for here is 3 millimeter. And what is for spreader? Okay, spreader and plugger, which are called obturating instrument. Okay, நம்ம யூஸ்வலாக நீங்கள் யூஜி படிக்கிறப்ப நம்ம ஸ்ப்ரெட்டர்ஸ் யூஸ் பண்ணியிருப்போம். எங்கே யூஸ் பண்ணியிருப்போம் அப்படின்னா லேட்டரல் கண்டென்சேஷன், ஜிபி அசசரி ஜிபிலாம் வச்சுட்டு லேட்டரலாக கண்டென்ஸ் பண்ணி ஸ்பேஸ் கிரியேட் பண்ணிட்டு அடுத்த ஜிபி வச்சிருப்பீங்களே, தட்ஸ் கால்ட் லேட்டரல் கண்டென்சேஷன். வெர்டிக்கல் கண்டென்சேஷன், ஓகே, லைக் தெர்மோபிளாஸ்டிசைஸ்டு ஜிபிலாம் யூஸ் பண்ணுறப்ப வெர்டிக்கலாக கண்டென்ஸ் பண்ணுவோம். வெர்டிக்கலாக கண்டென்ஸ் பண்ணுறப்ப யூஸ்வலி கோ ஃபார் வாட்? பிளக்கர்ஸ். So spreaders for lateral, pluggers for vertical condensation. So this is also a beautiful question. Okay, but a tricky question. Gatapacha can be dissolved inside the canal. Chloroform use பண்ணலாம், xylene use பண்ணலாம். ரெண்டுமே dissolvent for the gatapacha. But எது better option கேட்டா is chloroform is the better option because that is the most commonly used than your xylene. Okay, so chloroform வச்சு ஒரு GPA dissolve பண்றப்ப that is called chloropecha. We can also use eucalyptal, which is called eucapecha. Okay, and even orange oil, which is also used. So, but better option in Keta, answer A, which is chloroform. Okay, next question, students. Which of the periapical lesion which contain bacteria? That is the question. So, the answer for this is abscess. Okay, so which is called sterile. Okay, students, next question. The root fracture, you have the best prognosis, which is usually the apical third of the root fracture. Like usually you doesn't need any treatment. Okay, doesn't need any treatment. Usually you can leave it. Thevapatta splitting panala. Okay, apical root fracture is the very best prognosis. Okay, least prognosis again keta vertical fracture. Vertical fracture is just very difficult. So most of the time for the vertical root fracture, okay, the treatment of choice is extraction. Time-dependent plastic deformation is referred as what? It is called creep. There are two types of creep, students. One which is called static creep and dynamic creep. So, next question. The melting point of gold is 1063 degrees Celsius. And remember, which material has highest melting point in Keta? Tungsten. That is why tungsten is taken as a target material in your X-ray tube. What is the melting point of tungsten means? This is the answer, 3422. Right, students. Next question. Posterior core is indicated for badly damaged, non-vital and endodontically treated teeth. Obviously, this is the correct answer. Okay, students, next question. A patient with a high serum alkaline phosphatase increased parathermone level with low calcium and phosphate level. Okay, so parathermone level அதிகமா இருக்கு, but calcium and phosphate level கம்மியா இருக்கு. யூசுவலா parathermone அதிகமா இருந்துச்சுன்னா calcium level அதிகமா இருக்கும். Okay, but calcium level கம்மியா இருக்குன்னா அப்ப என்ன ஆன்சரா இருக்கலாம் அப்படின்னா vitamin D deficiency. Okay, suppose இந்த இடத்துல low calcium க்கு பதிலா high calcium னு கொடுத்திருந்தாங்கன்னா we can go for primary hyperparathyroidism. Low னு கொடுத்திருக்கிறதுனால the best option is vitamin D deficiency. Vitamin D deficiency obviously calcium level is low. Heimlich maneuver தெரியும் இல்லையா? Heimlich maneuver is okay, push the abdomen, make the foreign body to come out in case of the airway obstruction. இப்போ ரொம்ப நாள் கழிச்சு உங்க ஃப்ரெண்ட்ஸ் எல்லாம் மீட் பண்றீங்க அப்படின்னா ஸோ எல்லாம் திருச்சி பேசிட்டு இருக்காங்க. ஓகே, யாராவது ஒருத்தவங்க சாப்பிட்றப்ப ஸோ இன்ஸ்டெட் ஆஃப் இட் கோஸ் டு த esophagus, if it goes to the trachea, so then it is problematic, right? So then this process is called as what? Calf coronary phenomenon. Appa immediately what is the procedure we have to go for? It is called Heimlich maneuver. Students, the exact question which is asked in your exam, which is 30:2. 30:2. In a CPR compression technique, what is that answer is 30:2. That is the question which is asked. That is the option which is given in your real exam. Okay, but what is the answer is 30:2 is the answer. Usually 4:1. But yeah, 30:2. The option is 4:1 option is 30:1 4 among the option, best option is 30:1. Yeah. Suppose children's less than 1 year CPR ratio is, this is the answer, 30:2. So that's why we go for option C. Synthesis of DNA takes place in which phase of, obviously S phase. S means what? Synthetic phase. The DNA will synthesize, and usually cell multiplication is takes by the mitosis phase. Students, which was triad? Endothelial damage, okay, blood stasis, hypercoagulable, which are all together called as Virchow's triad. What is not happening in vasoconstriction does not happening in a Virchow's triad. Right, students? Next, platelet contain what enzyme means thromboxane A. Prostacyclin, which is synthesized by the blood vessel, students. Okay, right. Next, mast cells are predominantly found in connective tissue. And where is the, what is called mast cells? Mast cells are nothing but which is released in the allergy. Usually in case of a allergy or asthma, the mast cells will break and releases so much amount of histamine and leukotriene. Leukotriene, which causes bronchoconstriction, patient is not able to breathe. So that's why for the patient of asthma will be given something called as mast cell stabilizer. So students' answer is what? Connective tissue. Immunoglobulin M. Okay, 80% of the total immunoglobulin are kadayadu. 80% of the total immunoglobulin. Okay, majority of the immunoglobulin is IgG. Crosses placenta barrier? No, this is also IgG. Has a role in parasitic infection? IgE. Upper left out option in the glycoprotein. Solama, sila question eliminate panni podra mari irukku, and the skill romba important. Right, students. Next one. What is called induration? Induration appadina enga padichirupom appadina the induration அப்படின்றது யூசுவலா மான்டோக்ஸ் டெஸ்ட்ல படிச்சிருப்போம். மான்டோக்ஸ் டெஸ்ட்ல என்ன பண்ணுவாங்கன்னா டியூபர்குலோசிஸ்ல ஓகே டியூபர்குலின் இன்ஜெக்ஷன் கொடுத்ததுக்கு அப்புறமா பேஷண்ட்டுக்கு இன்டூரேஷன் இருக்கான்னு செக் பண்ணுவாங்க. இன்டூரேஷன் அப்படின்றது ஒரு ஹார்ட்னஸ். ஓகே, அந்த இன்ஜெக்ஷன் பண்ண சைட்ல ஹார்ட்னஸ் எவ்வளவு பெருசு இருக்குன்னு செக் பண்ணுவாங்க. So based upon this, they will say positive or negative report. So students remember, induration is not an inspection finding; it is a palpative finding. Now I can go for what? I can go for hardness, right? Right. Students, next question: ameloblastoma. What is the answer? Ameloblastoma, which is actually derived from the inner layer of the cells of the enamel organ. So answer for this is A. What is the simplest form of pulp therapy? It is called as pulp capping. And pulpotomy means removal of coronal pulp. Pulpectomy means removal of the entire pulp. So simplest I can go for pulp capping. Right. Next question. Loss of the vertical dimension in a complete denture, which leads to, okay, loss of interocclusal space. Okay. TMJ fatigue. So all of this. Right. Students, next question. Factors affecting the retention of the abutment, which include all except taper, height, surface texture. But in the metal use பண்றோம் அப்படின்றத வச்சு retention இருக்காது இல்லையா? So easy question. So we can go for option B. Next question. Temporization is done for. Temporization அப்படின்னா ஒரு டூத் ப்ரிப்பரேஷன் பண்றோம். ப்ரிப்பரேஷன் பண்ணி முடிச்சதுக்கு அப்புறமா டெம்பரரி கிரவுன் கொடுக்குறோம் இல்லையா? அதோட பர்பஸ் என்ன கேட்கறாங்க? So answer is obviously pulpal protection along with restoration of function and aesthetics. Okay, or incises crown preparation பண்ணிட்டு patient அப்படியே அனுப்பிச்சிடலாமா இல்லையா? So patient what aesthetics will be affected. So will be given temporary crown. So answer is aesthetics also, pulp protection also. So that's why the answer for this is D. So students, next question. What is the finish line which is given on the facial aspect of metal ceramic crown? Metal ceramic or ceramic crown, all ceramic crown. இது எல்லாத்துலயுமே we go for shoulder. In that we can go for shoulder with the bevel for the metal ceramic for the facial surface. Linguala என்ன கொடுக்கலாம்? Linguala metal மட்டும் தான் இருக்கும். Metal மட்டும் இருந்துச்சுன்னா தின்னா கொடுத்தா போதும், which is called chamfer. Chamfer ஓட finish line தின்னா இருக்கும். அதனால வெறும் metal இருக்கிற இடத்துல we can go for chamfer. Metal ceramic or all ceramic கொடுக்கறப்ப shoulder or shoulder with the bevel is the good option. What about knife edge? Knife edge is for the stainless steel crown. Okay, next question, students. Which of the following provides maximum retention? Obviously, full veneer crown, which is provide the maximum retention. So next question. எந்த டெக்னிக்ல நம்மளுக்கு இன்ஃபர்மேஷன் ஈஸியா உடனே கிடைக்கும்? இம்மிடியேட். Obviously simple, very simple question. So answer is digital radiograph. Right. What is centric relation? Centric relation. Centric occlusion is tooth to tooth. Centric relation is bone to bone relation. Right. A process is used to close the opening in the palate is called as easy question, right? Easy question. The answer is what? Obturator. Right. Next question. The primary mandibular second molar. Usually, second molar usually resembles the first molar of the permanent teeth. Second molar of the primary teeth resemble the first molar of the permanent teeth. So that's why we go for mandibular first permanent molar. Right, students. Next question. Distal extension partial denture, which usually require a dual impression protocol. So answer is B option. Okay, the cross-section shape of the lingual bar, which is off-pear shape. And in case of a full veneer crown preparation of mandibular molar, what is the occlusal clearance? Usually, will go between 1.5 to 2 millimeter. So here we take minimal, so it is called 1.5 millimeter. Right. Students, next question. What is the primary function of access opening? Whenever you go for an access opening, it should be straight line access. So the best option for this is straight line access to the apex. Students, here they're asking about what is the off-life of mercury, average off-life of the mercury. The average off-life of the mercury is 55 days. Students, remember, they may ask you this question also. What is the off-life of iodine 131? The half-life of iodine 131 is 8 days, students. Okay, so both are important question. Both half-lives are. Okay, next question. Okay, suppose if we have 5, what is the working part? The working part of the file is usually 16 millimeter. Okay, this is where the area you will be having the flutes. So answer is 16 millimeter. And usually what is used in hot salt sterilizer? It is a little controversial question. Many books what says which is go with a common table salt. No, but according to my opinion, along with the common table salt, they also add a minimal amount of magnesium carbonate. So I will go for option B, students. Right. Next question. What is called double edging? Double edging is usually done with a wide proximal box where you will be given one wedge from the buccal side, the other wedge from the lingual side, which is called as double wedging. Okay, and where you can go for a piggyback wedging. Piggyback wedging is done in the case of a gingival recession. One larger wedge, below that larger wedge, you will be having a smaller wedge, which is called piggyback wedging. What is called wedge wedging? Wedge wedging எங்க பண்ணுவோம் அப்படின்னா maxillary first premolarல பண்ணுவோம். ஒரு wedge வந்து occlusal surfaceல, இன்னொரு wedge வந்து proximal surfaceல இருந்து உள்ள கொண்டு வருவோம். This is called as wedge wedging. இந்த டெக்னிக்ல எது வேணா கேட்கலாம். So, okay, next question, students. Sprue is usually attached to what degree? Sprue is usually attached at 45 degrees, students. Right. Next question. What is called anti-cariogenic property of the GAC is due to some easy question. Yeah. Answer is what? Fluoride. Okay. Students, next question. இப்போ இந்த மாதிரி கொஸ்டின்ஸ்லாம் 2025 எக்ஸ்பெக்ட் பண்ணலாமான்னு கேட்டால் கொஞ்சம் டவுட் தான் இல்லையா? ஸோ ஒரு ஃபியூ கொஸ்டின்ஸ் ஒரு 30 to 40 கொஸ்டின்ஸ் அந்த மாதிரி கொடுத்துருப்பாங்க. ஓகே, மீன் எல்லா பீப்புளையும் சாட்டிஸ்ஃபை பண்ணுறதுக்காக அந்த மாதிரி சில கொஸ்டின்ஸும் ஃப்ரேம் பண்ணுவாங்க. ஓகேவா? பட் டிசைடிங் ஃபேக்டர்ஸ் ஒரு 100 கொஸ்டின்ஸில் 2025ல ஒரு 10 to 15 கொஸ்டின்ஸ் இருக்கலாம். தட் இஸ் த டிசைடிங் கொஸ்டின்ஸ். அந்த கொஸ்டின்ஸ் கொஞ்சம் கேர்ஃபுல்லாக ஆன்சர் பண்ணணும். வித் அலாங் வித் தட் ரிமைனிங் 85 கொஸ்டின்ஸ் நீங்கள் கரெக்ட் ஆகணும். ஓகேவா? ஸோ வி கேன் எக்ஸ்பெக்ட் அ குட் அமௌண்ட் ஆஃப் கட் ஆஃப் இன் யுவர் நீட் 2025. Right, students. Next question. Rest position of the mandible is determined by what means? Muscles and gravity. So answer is B. Retrofilling material of choice in apical surgery is what means? Again, MTA is the best material. Okay. MTA word powder liquid ratio padichamma, which is called 3:1. And there are two types of MTA. One which is called gray MTA, white MTA. Okay, then the question put 2025. What is the reason for the gray MTA? Why it is gray color? The gray color is presence of the iron. Okay, iron, more iron in the gray MTA, that is why it look like a gray MTA. Okay, so next question. What is the reason for the marginal deterioration of the silver amalgam is called as what? Marginal deterioration of the silver amalgam is called as ditched amalgam. What is called amalgam blue? What is called amalgam tattoo? When you give amalgam restoration, if the amalgam restoration causes discoloration of the hard tissue, then it is called amalgam blue. Suppose when you do the condensation of the amalgam, if some amalgam sprinkles out and causes discoloration of the soft tissue, then it is called as amalgam tattoo. What is the ADS specification number for amalgam? 1. What is the ADS specification number for mercury? 6. Students, next question. Next question. Microorganism responsible in the initiation of the enamel caries or initiation. What is the answer? Streptococci. Which organism causes propagation? Propagation lactobacillus. Recent or 2 days before the NEET exam question root caries is caused by which organism? Actinomyces. Okay. Not exactly actinomyces, this is called actinomyces, Actinobacillus viscosus. Right. So answer is Streptococcus mutans. Apicectomy is done only for, again, students, it is a little controversial question. Okay, so this question you can go for all of this, but preferably anterior teeth. Okay, most common keta anterior. Okay, but premolarly, molarly, padlaman keta. Yes, if you have a good skill, then you can go for premolar and molars also. No wrong in that. Most common keta incises, mean anterior teeth. What is called eutectic? Eutectic has specific melting point. Okay, what is the meaning of eutectic alloy, students? Eutectic அப்படின்னா ஒரு ரெண்டு அலாய், ரெண்டு மெட்டல், அலாய்னாலே ரெண்டு மெட்டல் மிக்ஸ் பண்ணும். ஓகே, ஒரு ரெண்டு மெட்டல் இருக்குன்னு வச்சுக்கலாம். மெட்டல் ஏ, மெட்டல் பி. மெட்டல் ஏ ஓட மெல்டிங் பாயிண்ட் 1000, மெட்டல் பி ஓட மெல்டிங் பாயிண்ட் ஒரு 700 வச்சுக்கலாம். ஓகே, நம்ம யூஸ் இந்த மிக்ஸ் பண்றப்ப ஒரு ஒரு கம்பைன்டு மெட்டல் கிடைக்குமா? இந்த கம்பைன்டு மெட்டல் மெல்டிங் பாயிண்ட் வந்து இந்த ரெண்டு மெல்டிங் பாயிண்டை விட கம்மியா இருக்கும். தட் இஸ் த கேரக்டரிஸ்டிக் ஃபீச்சர் ஆஃப் eutectic alloy. So the metal property, combined alloy property, temperature of the melting point of the alloy is lesser than the temperature of the two metals, which is called as eutectic alloy. Students got it right? So shall we go to the next one? Sonic system. So there are two things which is called a sonic system, ultrasonic system. Ultrasonic, which uses sodium hypochlorite. Sonic, which uses water. Okay, again, this is very important. Ultrasonic, which rotates in the high speed. Okay, right. Next question. The instrument that is used to safely remove pulp from the root canal is called barbed brooch. Barbed brooch is called exploring instrument. Sorry, not student. Extirpating instrument. Extirpating, remove the pulp tissue from the root canal. And what is called exploring? Canal orifice explore பண்றதுக்காக யூஸ் பண்றதா smooth brooch. Students remember? Right. So what is regarding pulmonary function test? All are true except. Students remember, FEV1 is forced expiratory rate. Correct. இது வரைக்கும் correct. At 1 minute கொடுத்திருக்காங்க. It is not 1 minute. It is 1 second. So we can go for eliminating option D. Students, next question. Which of the following statement is not true about temporomandibular joint? Can function independently on each side? No, students. Surely TMJ will work simultaneously for all the function. So it cannot, we each, whatever TMJ மட்டும் தனியா function ஆகுமான்னு கேட்டா no. Yes. So we can go for option C. Which of the following antibodies is mainly responsible for opsonization? What is called opsonization? Opsonization is called as coating of the bacteria. Make the bacteria beautiful, colorful. That is called as opsonization. So that the RWBC will come and engulf the bacteria. So IgG and IgM both will help for the opsonization, but still better option keta. IgG is the better option. Students, we are seeing so many immunoglobulin questions, right? So next question, cylindroma is otherwise called as adenoid cystic carcinoma. Students, next question. Step ladder pattern of pyrexia is seen in what? Where? Enteric fever. Enteric fever is nothing but typhoid. டைஃபாய்டில் என்ன ஸ்பாட் இருக்கும்னு கேட்டால் ரோஸ் ஸ்பாட்ஸ் இருக்கும். ரோஸ் ஸ்பாட்ஸோட மோஸ்ட் காமன் சைட் என்னன்னு கேட்டால் செஸ்ட். ரோஸ் ஸ்பாட்டையும் கன்ஃபியூஸ் பண்ணிடக்கூடாது. ரோஸ் ஸ்பாட் அப்படின்றது விச் இஸ் சீன் இன் இன்ஃபெக்டிவ் எண்டோகார்டைட்டிஸ். அதே மாதிரி பைட்டாட் ஸ்பாட் where you can see the bite spot. Bite spot is in vitamin A deficiency. Right, students. Next question. BCG vaccine. BCG vaccine is attenuated tubercle bacilli. Okay, and which of the following is amide group of local anesthetics? Obviously, amide na ரெண்டு இருக்கணும். Lidocaine and bupivacaine. But எல்லாத்துக்கும் அது மேட்ச் ஆகாது. எக்ஸப்ஷனா இருக்கு. எக்ஸப்ஷன் என்ன எக்ஸப்ஷன்னா பிப்ரோகைன். பிப்ரோகைன் ரெண்டு இருக்கா? பட் ஆனா இது என்னது? எஸ்டர். அதே மாதிரி xylocaine. xylocaine ஒரு ஐ தான் இருக்கு. ஆனா இது அமைட். ஏன்? Because xylocaine is nothing but other name of lignocaine is xylocaine. Lignocaine is amide. Okay, and students remember, which is the most commonly causes allergic reaction? Ester or amide and keta? Ester. Allergic reaction is more common. Okay, and இது வந்து நம்ம காமனா யூஸ் பண்றோம் அப்படின்னு கேட்டா amide. So amide causes less allergic reaction. And which is the longest duration of local anesthesia means etidocaine. Shortest acting local anesthesia means chlorprocaine. Students remember the next question. Suppose if we give low dose aspirin for a long term, okay, in the patient obviously patient with a myocardial infection, you will be having a long dose aspirin to prevent the re-attack. Okay, pre-myocardial infection. So the answer is D, students. Next question. The commercially prepared local anesthetic solution have a pH of 5.5 to 7. Okay, which just mean what? Slightly acidic. Okay, whenever go for a slightly acidic, okay, this acidic pH usually decrease the oxidation capacity of vasopressor. Usually vasopressor, which usually metabolized, okay, oxidize. Okay, in a neutral or alkaline pH. So the கம்மி பண்றதுக்காக என்ன பண்ணுவோம்? Acidic condition create பண்ணுவோம். So the answer is what? C. Okay, next question. 1 milligram of 2% xylocaine which contain how many milligram of xylocaine? Which is 20 milligrams. Straightforward question. Next question. Some tricky question, students. Super tricky question. Okay, any drug which is entering from any systemic route other than oral is exposed to the first pass metabolism. Some tricky question, இல்லையா? Okay, usually oral அப்படின்னா நம்ம என்ன சொல்லலாம்? லிவர்னு சொல்லலாம், இல்லையா? பட் அதர் தென் ஓரல்னு சொல்லியிருக்காங்க. அப்போ இந்த கொஸ்டின் நம்ம எப்படி தான் ஆன்சர் பண்ணலாம்? அப்போ லங்ஸான்னு கேட்டா லங்ஸ்ல மோஸ்ட்லி த ட்ரக்ஸ் டஸ் நாட் மெட்டபலைஸ்ட் எக்ஸப்ட் வெரி வெரி ஃபியூ ட்ரக்ஸ். Okay, among this is called, one drug is called cyclisonide. Cyclisonide. What is called cyclisonide? Cyclisonide is a steroid. It is usually metabolized in the lungs itself. That is why cyclosinide otherwise called a soft steroid. Appa lungs and keta, no, definitely no. Kidney la usually drugs does not metabolize. This is excretion. Okay, liver or intestine? Okay, intestine. Oral எடுத்துக்கல, அப்ப எப்படி intestine-க்கு போக முடியும்? Okay, அப்ப intestine is not answer. அப்ப remaining answer is liver. So yes, preferable is liver for this question. So next question, students. The depression effect of narcotics are increased by the concomitant administration of, okay, narcotic, you know, right? So our depression effect is increased by barbiturates, yes, benzodiazepine, antihistamine, because all these three are sedative drugs. So we can go for what? All of this, right? So straight wire appliance, which is given by whom, means Andrews. Straightforward, author-based question. Okay, next question, students. Adams wiring. Adams wiring is related to the circumferential mandibular wiring. Okay, next one. Which are the following is a tooth size discrepancy analysis? Answer is bolt-on analysis. Okay, and which are the following is a mixed dentition model analysis? Okay, mixed dentition is Nance Carey's analysis. Okay, next question, students. Okay, maxillary molar usually have 3 roots. Mandibular molars which has 2 roots. The reason because of this is because of the differential osteology of the maxilla and mandible. So we can go for option C. Okay, next question. What is the optimal time to employ an orthodontic appliance that takes advantage of the growth? Okay, so usually which period is the best time to go for an orthodontic treatment? Means we can go for, yes, the answer is late mixed dentition. Gingivitis is peak between the age of 11 to 13 years because it is a stage which is called ugly duckling stage. And gingivitis is most common even in the stage, right? Students, next question. A child patient who demonstrate resistance in the dental office usually manifesting. Okay, so the answer is anxiety. Anxiety, right. Students, next one. Lag phase of the tooth movement is caused by the time taken for. Lag phases, there is no tooth movement. Okay, அப்ப என்ன ஆகும்னா அந்த hyalinization phase remove பண்ணதுக்கு அப்புறமா தான் tooth movement will start. So answer is C option. Okay, so hyalinization to be removed for the tooth movement to happen. Late mesial shift, which is usually taken the leeway space, who is called as father of dental hygiene, which is Alfred Folds. What about G.V. Black? G.V. Black is called father of operative dentistry. Father of modern endodontics is Grossman. Okay, students, next question. When there is a color change to yellow within 24 hours in a Snyder's test. Okay, Snyder's test என்ன பண்ணுவாங்கன்னா color change நடக்கும் 24 hours, 48 hours, 72 hours color change நடக்கும். 24 hours color change நடந்துச்சு அப்படின்னா, which is we can say definite caries acceptability. 48 hours இருந்துச்சுன்னா marked caries acceptability. 72 hours இருந்துச்சுன்னா limited caries acceptability. This is 24 hours, this is 48 hours, this is 72 hours. So and the wording அப்படியே படிச்சுக்குங்க. Sorry students, this is 24, definite is 48, limited is 72. Right, students, next question. Hemangioma is more common in Sturge-Weber syndrome, Plummer-Vinson syndrome, and Patterson-Kelly syndrome, which are iron deficiency anemia. Both are same. Okay, and calculus is more common in submandibular. Okay, the reason you know, because the gland or a duct which has tortuous force, the saliva is coming against the gravity. Okay, next reason. The third is it has more mucus in nature. So that's why submandibular gland, the calculus is more common. Wickham striae, easy question, right? Wickham striae, which is seen in lichen planus in your buccal mucosa. Okay, right, next question. Osteoclastoma. Okay, what is called odontoclastoma? Odontoclastoma is internal reception. Osteoclastoma is central giant cell granuloma. Right, so the next one is about lamina dura. So lamina dura is students, it is a radiographic appearance of alveolar bone proper is called as lamina dura. Usually you have in the radiograph around the root surface, you can see the radio-opaque border. This radio-opaque border is called as lamina dura. The radiolucent space is called as perial space. So in case of an inflammatory condition, the lamina dura became absent. What is called anterograde amnesia? Anterograde amnesia is it is a failure to remember events immediately following the accident is called as anterograde amnesia. Okay, next question, students. What is the angle of the back of the handle in the mandibular molar extraction forceps? So answer is 90 degree. Students, next question. The facial artery was accidentally cut during the surgical procedure. What should be done? This is the question. So the answer is apply the pressure at the inferior border of the mandible in the first molar area where the facial nerve enters into the face. So answer is this. Okay, bone wax does not help for the fixing of the facial nerve. Okay, vasoconstrictor with LA does not fix. Okay, apply pressure on the buccal fat doesn't help. So this is the best option. Why this is the best option? This is the area where the facial nerve enters into the face. Okay, once the facial nerve enters into the face, it gives 5 branches over the parotid gland. You know this, right? So next question. Which of the following is not a cephalometric analysis? Student, the answer is Ashley House analysis, which is not a cephalometric analysis. Okay, next question, student. The dental nurse scheme was established in. Answer is Wellington. Okay, Dentist Act was done in the year 1948. All these are fact-based question. Okay, a child accidentally swallows fluoride solution. What is the immediate treatment? Yes. Okay, what is the chelating agent for the fluoride? The chelating agent for the fluoride is milk. Okay, calcium. Calcium which is present in the milk. So that's why we can go for option C. What is the simple method to educating the child towards the caries control? Yes, students, very simple. Answer is visual aid. We can educate the child. Okay, right, students. Suppression in the periodontal pocket. Suppression which does not give proper idea about the past condition. Okay, so that's why it is not a very important feature of periodontal disease. So we can go for option B. Option B. Option B. Right, so the next question. The instrument of choice for removing deep subgingival calculus and root planing. Yes. Answer is curette. Okay, predominant connective tissue cells of the periodontal ligament are. So answer is fibroblast. Okay, and periodontitis is considered when it is localized, when there is attachment loss and bone loss in less than 30% of the site. So best option is D option. Next question. Single tufted brush. Enga use panala? Type 3. Type 1 la enna use panala? Floss. Interdental brush type 2. So answer is type 3 embrasure. Okay, the next question. The placement of intraoral incision and flap is determined by. Okay, incision and flap is determined by. This answer is all of this: convenience, access, avoid damage to the adjacent vital structures. So, students, next question. This is an example for the monofilament suture material, which is resorbable. Okay, obviously, what? Answer is catgut. Sorry. Students, again, this is a tricky question. Resorbable means is catgut also resorbable, polylactic acid also resorbable, but the key point here is monofilament. Okay, catgut is actually multifilament, but it looks like monofilament. But what about polylactic acid? Polylactic acid as such mono, so monofilament. So we can go for option D. Students, next question. Periodontal disease, diabetes is considered as a risk factor, obviously. Next question. Localized aggressive periodontitis was earlier referred as. Yes, answer is periodontosis. Okay, and next question, students. Motivation. Yes, it is also a little controversial question. Teaching others, making others understand. Yes, calculate the effectiveness of the program. Okay, so all of this. Yes, we can go for all of this. Okay, next question. What is the cephalometry is used to determine? Cephalometry is used to determine growth and development of the facial skeleton. Yes, answer is C. And next question. A child facing the dentist for the first time has a basic fear of unknown. First time, that is a key point. So answer is unknown. Right. What about the use of the Frankfurt horizontal plane, which is usually helps for the indicates orientation of the maxilla relative to the cranial base, students. So answer is D. Next, chin cap is used for correcting the class 3 malocclusion. The last question, the residual ridge does not contain, obviously, periodontium. So these are the 200 questions he successfully completed. Right. There are little or few questions are tricky question and few questions are controversial questions. Okay, for controversial questions, I told, okay, 1 or 2 questions I told this is a controversial. So please, students, check about this controversial questions with your reference. Okay, so go with your idea, your reference. Okay, this is my own idea, right? So students, prepare well. Okay, in 100 questions, I'm going to fast but because of the time limit, I don't want make you to spend much time in this question paper. So I just given in the fast mode. So please, இன்னொரு time full உட்காந்து go through பண்ணிக்கோங்க. Exams சூப்பரா பண்ணிட்டு வாங்க. Okay, and நல்லா யோசிச்சு எழுதுங்க because we don't have negative marks. So அதனால very narrow rangeல தான் மார்க்ஸ் இருக்க போகுது. அதனால ஒவ்வொரு கொஸ்டினும் ரொம்ப முக்கியம். நல்லா பண்ணிட்டு வாங்க. Okay, all the best. So our prayers are with you. Okay, congratulations and best wishes from Ardent MDS. Bye, students.